All right, thank you for joining us. I hope everyone enjoyed the video on vaccine hesitancy and the COVID-19 caveats. Now we're doing a follow-up conversation with Dr. Daniel Salmon. As you know, he is a professor at Johns Hopkins Bloomberg School of Public Health, as well as the director of vaccine safety at Johns Hopkins. And now we would like to follow up with some questions regarding vaccine hesitancy in the United States. I'd also like to introduce our two students, future Dr. Kirsty Freebert and future Dr. Erica Hall, Xavier University College of Pharmacy class of 2022. So let's go ahead and begin the conversation.
Hi, so as stated earlier, my name is Erica and I'm a fourth year pharmacy student. So question to Dr. Salmon. So vaccine hesitancy is not a recent problem. Have there always been racial and ethnic disparities regarding vaccine hesitancy?
Hi, Erica, it's nice to talk with you. So as long as we've had vaccines, there's been hesitancy. I mean, the first vaccine for smallpox, there were huge proportions of the population that were against the vaccine. And, understand we didn't know smallpox was a virus, and it was a vaccine that came literally from cows. So there were all sorts of resistance to the vaccine. And it tended to come and go with waves of disease. When we saw waves of smallpox, more and more people wanted the vaccine. And as it came down, people were less interested. And with every vaccine and across many, many countries and across the world, and over time, we've seen hesitancy. I mean, racial disparities in the US among children were largely addressed by improving finance and delivery and access to vaccines. So it really wasn't hesitancy that impacted childhood vaccines, because if you address access, you change that gap. What we see with COVID, and historically among hesitant groups, they tended to be better educated and more likely to be white, and tended to be in a more naturopathic environments or back to medicine or alternative medicine, and often associated, clustered geographically, socially. What we see with COVID, I think, is a bit more challenging because of the pandemic, and because the pandemic really showed so many of the racial and ethnic disparities that exist in our country and in our healthcare system. And it really brought to bear a lot of the histories of problems in medicine and public health in historically poor and disadvantaged populations. So, I think it's somewhat different with COVID, and it's a challenging issue.
Thank you, Dr. Salmon. My name is Kirsty. Like Dr. Aldier previously stated, our second question we have for you is, what do you believe are the reasons for an impact of low vaccination coverage in different regions?
Well, when you think about vaccine coverage, it's a local issue. It doesn't really matter what vaccine coverage is in the US or even in your state. It's all local. And there's lots of examples of this. We saw this with measles outbreaks in the late 80s and early 90s. And we've seen it over the last decade, where measles is introduced into a community with low vaccine rates, even though at the larger scale, vaccine coverage is very good. So it's a local issue. And when you have regions with low coverage, it's even worse. But when you have neighborhoods and communities, you still really have a problem. So when you think about vaccine coverage, really think about it as a local issue.
Thank you. And our next question would be, what are some challenges of vaccinating young adults?
Well, I have 2 young adults, and you would think that they would have been vaccinated a long time ago. And I started by presuming they would want to get vaccinated. And then I started trying to talk with them about it, and then trying to understand their concerns and address them. And then I went back to older parenting techniques, like really bugging them. And, and it was really hard. I think what it came down to was they didn't feel like COVID was much of a threat for them. And I tried to emphasize the risk they would pose other people at to, because if they got COVID and brought it home to me, well, I'm at higher risk. And how would they feel if they got me sick? That didn't even work, but they wanted to travel and they had to get vaccinated to do so. And I'm pleased to say they are, which kind of feels like a personal failure, I have to admit, although they are vaccinated. But to me, what I found and what you see in the data among young adults is the biggest issue is risk of disease, or importantly, how they perceive that risk. I think it's coupled with young adults that feel invincible and are much less risk adverse than older people are. I guess they haven't learned their lessons in life yet. And I think that's a real challenge. And I'm giving you the story of my anecdote, but it is really supported by a lot of data. Also, their news sources are very different. And they're reading all this stuff on their phone, and they don't really have any way of separating fact from fiction. So they don't really believe any of it. And they ask, well, how am I supposed to know? And I did suggest that I might be a good source for them. But I think that's part of that generation as well, as where they get information and how they get information and what they believe and what they don't believe.
Thank you. Our next question we have for you is, as future pharmacists, what 3 counseling points would you highlight for a pharmacist when addressing a vaccine hesitant or a vaccine resistant individual?
Well, I'd start off by not presuming people are hesitant. In fact, I would presume the opposite. I would presume that they very well want the vaccine. The vaccines for your adults are now through a full BLA. They're fully approved. They're recommended by the CDC, but professional medical associations. That is the standard of care. I would presume they want the vaccine. And I would say, hey, do you need a vaccine? Can I get you a vaccine? While you're here, do you want one? So I would presume that they do. And that default option, the presumption as your pharmacist that they would want the vaccine, is actually really important. So don't presume they're hesitant. If they are hesitant and they express a concern, I would start by finding a way to connect with them. And don't get, well, I know better, let me tell you what you need to do. Ask them what their concern is, and then find a way to connect with it. And probably you, as somebody providing healthcare to them, and them as a person that wants to be healthy, probably have common values. So what is that? So if somebody says, well, I'm worried about the ingredients in vaccines, they make me nervous. Well, I wouldn't say, well, I understand why you're worried about vaccine ingredients, because that is finding a connection. It's also reinforcing a myth that there's a problem with the ingredients. So I would say, I know why you want to make sure everything that goes in your body is healthy. And because you do share that value, that belief, right? So you're hearing them, you're repeating that, you're finding a way to connect, but you're not repeating a myth. And then I would address the concern, and I would do it with hopefully the knowledge you have of the issues. I would keep it succinct. I wouldn't go on for 20 minutes, and I would include it with the risk of disease and the benefit of vaccination. And hey, are you ready to get your vaccine?
Great, thank you.
Thank you for those excellent points. Those are really important take-home points, especially for our community pharmacists, where they do have those long-term relationships with their patients and their customers, and finding those opportunities to connect while enforcing the positive is really important. So for our viewers out there, I'd like to remind you to go ahead and submit your evaluation, and please go ahead and post any additional questions you might have on the discussion board, and so we might continue this conversation offline as well. Thank you so much for joining us, and we look forward to future insights from you, Dr. Salmon.
Well, thank you. It's been great to be here, and thank you all for your time. It's nice to meet you.
Thank you.